You know, computer work, whether it's for fun or for a job, really sometimes appears to be a fairly low impact, low effort type of activity. But in perspective, whether you're hurting because your posture is not right, or you're performing these highly repetitive tasks for extended periods of time, it can really lead to some serious problems. People can face risks of MSDs or musculoskeletal disorders from performing repetitive tasks without taking proper breaks, or just from using a computer keyboard and mouse for an extended period of time. Not only computer work, but even other office tasks carried out without breaks can lead to repetitive stress injuries, such as simple things like stapling or reading for an extended period of time, sitting in the same position at the same desk in the same chair for a long period of time, or even those things that are high repetition tasks. All of these usually require long periods of static posture and can lead to postural strain. Let's take a closer look at what some of these repetitive stress injuries include. One is carpal tunnel syndrome, which is known as a swelling that's inside a narrow tunnel formed by bone and ligament in the wrist. Another one is called epicondylitis. Now, these are great Scrabble words, but they do have some very important meanings, which is going to be something that's going to disable one if they don't fix it and stop the process. But the epicondylitis, it's usually dictated by soreness in the elbows, commonly known as tennis elbow, but this can be extremely debilitating. Another one is a ganglion cyst. Usually cause a lot of problems. Sometimes you can get them just from a sudden injury, not repetition. But the ganglion cyst could cause problems if it starts to get big enough that it really affects the joint, because really it's this jelly-like substance that has leaked from a joint or a tendon, and it gets into this sheath which kind of starts to separate away from that joint or tendon, and if it gets big enough, it causes pressure. Now, this is the type of thing where you heard the old school, get the old dictionary book and just hit it really hard and pop it. I wouldn't go there. I would go to your doctor. And then if your doctor hits it with a book, that's their issue, not yours. But in most cases, they'll drain it and then you'll rest it to try to keep that from coming back. Another one is reflex sympathetic dystrophy. Now, this is a condition characterized by dry, swollen hands and a loss of muscle control. It's consistently painful as well. So this is something you're going to want to let your doctor know about. A more common one is tendinitis. And tendinitis is anywhere there's tendons. So the symptoms could be inflammation and the pain, but it could be in any tendon. And remember, a tendon is a connecting tissue that connects bones to muscles. They're highly susceptible to overuse and strain. And if you start to feel those symptoms, it's going to be important to let your physician know that. You don't have to let repetitive tasks lead to these types of injuries. The awareness of time, changing your tasks frequently, and the proper placement of items that are in your workspace can really help you minimize the risk of developing MSDs and stop the progression from an acute injury to a chronic illness that could debilitate you.